What were some of the events that caused trauma to Indigenous people in Canada?
So residential school system was one of the major tragic events that have happened. These schools were subject to a lot of abuse, exploitation.
Does this inequalities have any contribution to the rise in HIV cases?
Homelessness is the biggest issue, is a big economic inequality. Overall, Canada, we are experiencing a biggest problem, this healthcare crisis.
These ideas of stigma, racism could be related to that.
Because of their skin color, and because of their race and religion, and also language issues. They don't have any trust on healthcare providers.
What is the connection between homelessness and the spread of HIV?
Sometimes they do not have privacy to practice their sexual behaviors. Maybe they are using multiple partners. Maybe they are prone to sexual violence and exploitation.
What is the responsibility of the community?
Community has the biggest responsibility to reduce stigma and discrimination. Our annual awareness event called AIDS Walk. This is happening on September 20th in downtown Prince George. You have a possibility to support us in our efforts to eradicate HIV.
Welcome to North Pacific Podcast by Unicare Productions. Today we are going to dive into some of the most pressing public health concerns in British Columbia. We are talking about the intersection of HIV, homelessness, and substance misuse. Our guest today is Vibusha Madanayake. We thought that she's the most suitable and the best resourceful person that we could invite to discuss this topic because she's an expert in public health and human rights. She's currently serving as the education manager at Positive Living North in Prince George, British Columbia. She brings a wealth of experience for her work both in Canada and internationally, focusing on gender equality, sexual and reproductive health education, and empowerment of marginalized communities. Hello, Vibusha. We warmly welcome you to North Pacific Podcast today. And thank you for joining all the way from Prince George today.
Thank you so much, Anuradha. Thank you for having me.
Sure. So when we first discussed about this podcast, we didn't really know where to start. So I thought that we should start the discussion from all the way back from talking about the history of Canada. Let's talk about a brief history of Canada to begin with.
First of all, I need to say I'm neither Canadian citizen nor an Indigenous person to talk about the history of Canada in depth. I am an immigrant, and I actually came here to study my Masters of Gender Studies in University of Northern British Columbia. So now I'm working a full-time employee at the Positive Living North, as you mentioned earlier. The things I'm going to mention as the history of Canada is based on my education and experience, especially the community experience I gathered all through my work in Canada. So when you talk about history of Canada, you can actually divide into three sections, I would say. So the first section would be Indigenous history. It is pre-colonial era, and then we can come to colonization period. And the next one would be the modern Canada, what we see in Canada right now. So when you talk about Indigenous history, so we have three distinct Indigenous groups in Canada. It's First Nations, first of all, First Nations. So First Nations group is very unique and special in their culture, language, and lifestyle. So they actually located across Canada, and there are over 600 First Nation groups all throughout in Canada, and they are located in all provinces and territories. And then when it comes to Inuits, they are mainly located in Arctic region in Canada, so they are used to these harsh climate conditions in Arctic regions, and they they are located in Nunavut. And then they also have some, very special, unique lifestyle, especially with hunting and, they are very used to live in their lives, especially in Arctic region climate. And then the next group would be Métis. So this Métis group is actually mixed group, and they are actually they are born to First Nation women and settlers, men settlers. So these men settlers are mainly fur traders, and they actually came here for economic purposes, and they are primarily French and Scottish. So those three groups are the main indigenous groups in Canada. And then we are coming to the colonization period. So in this colonization period, actually from 16th century to 19th century, Canada was colonized mainly from British and French. So first, French colonized the area located in Quebec, what we now can see in Quebec mainly. And then after some time, there was a lot of wars, especially 7 years wars between French and British. And then British got the major power because there was a huge power struggle in Europe as well as in Canada between French and British. And after the 7 years war, British was the one who won the war, and they got the whole power in Canada, and they actually colonized Canada until 19th century. And after the 19th century, what we can see now is modern Canada. So modern Canada was designed after they got the independence from British colonies. So this is the brief history of Canada.
Yeah, thank you so much for that. I think that is the briefest one could ever be about explaining a history of country, because a lot of our listeners and viewers are newcomers, most of them, and I think it's really important that we all get to know about the history of the country that where we are living, and to understand what is happening now better, we should understand what happened earlier. So I think that was great insight into it's a good foundation to what we're going to discuss now. So what is if we talk about the events after uh, the history that you described, what were some of the events that caused let's say trauma to indigenous people in Canada, and what were the outcomes of these incidents that created the issues that we see today in Canada?
Okay, so there are series of events that have happened historically to Indigenous people. The first of all, the main event that could happen is just colonization. So with the colonization, this lot of indigenous people had to relocate. So they actually they have to be displaced because of the colonization. They had to travel from their ancestral lands because lots of colonizers were trying to doing a lot of expansion, like especially I would say like the resource extraction, because that was one of the the primary requirement of colonization is the resource extraction. So lots of colonizers came to different places, not only Canada, but all around the world. One of the major requirements of colonization was this resource extraction. So they did like oil extracting and mining and also lodging. So they had these First Nation groups had to relocate from the ancestral land. So that was very traumatic. And then we can mention residential school system. So residential school system was one of the major tragic events that have happened to Indigenous communities in Canada. So these lots of Indigenous children they actually taken from their families and they were placed in school systems. So it is also known as Indian boarding schools, and this schools were subject to a lot of abuse, exploitation, physically, emotionally, as well as sexually. There were a lot of abuses were happening in these residential school systems. So it was very traumatic. And then maybe 60s coup is another tragic event. So these indigenous children were taken from those families and they were adopted by non-indigenous families, and they were taken from indigenous families and they were adopted by non-indigenous families. And then so they actually lost the connection with the indigenous family, indigenous relatives. So this was also like a result of colonization, and it was very traumatic, and we actually can see a lot of negative results of these traumatic events. And then there were so many systematic racisms at the moment. It's actually came from historically, but it's still happening with the systematic racism we can see in the different institutions like healthcare, education, and justice system. So those were some of the traumatic events I can mention.
Okay, so let's get into HIV. I think it's called epidemic in Canada right now. So what's the current situation with the HIV epidemic in Canada, especially in British Columbia, because we are living in British Columbia and we are focusing a lot about British Columbia today. And is there any progress with the initiatives that are already taken by the government and other organizations?
Yes, I think when I mention about the HIV was really like kind of epidemic and dreadful disease when it was started in 1980s. So according to the reports and research we have done so far in BC in terms of HIV, during the 1980s and 1990s, there were 1,000 cases per year were reported that time. But at the moment in BC, we can see only like maybe 120 cases per year. So it was really manageable, and especially with the development of science and technology and new medications, we were really fortunate now to have these new medications for HIV, so we can actually minimize the deaths of HIV deaths. So at the moment, the province of British Columbia and overall Canada, we can see so much progress in terms of HIV. At the moment, as I said before, so northern BC can be like very maybe kind of different case from the other parts of BC. But overall, BC has made a very progressive, substantial progress in terms of HIV. So we can actually, we are not really experiencing deaths, HIV or AIDS related deaths so far, because we have actually a lot of medications and a lot of testing happenings all around BC.
Right. So since you are in this public health research field, do you think, in your experience, does this inequalities in rural and remote areas in British Columbia, especially, does it have any contribution to the rise or the numbers we are seeing in HIV cases?
Exactly. I can, the ruralness and remoteness, and there are so many inequalities that are happening in the northern British Columbia. So it's a big problem to minimize HIV-related deaths and HIV transmission in northern British Columbia. So first of all, I can mention the homelessness is the biggest issue because we can see a lot of unstable housing. It's not really stable, like lots of people do not have access to stable housing, is a big economic inequality in northern British Columbia, and lack of transportation is one of the biggest issues, because we cannot actually reach out to different rural and remote areas because we do not have much transportation services available in northern British Columbia. And also climate change and environment conditions, because like northern British Columbia is very prone to very hard climate conditions, especially during winter times. It is very extreme cold conditions actually can be a problematic for HIV transmission. And then and it's not just in northern British Columbia, but overall Canada and overall BC, we are experiencing a biggest problem, this healthcare crisis, especially due to the lack of healthcare providers in overall Canada. So in rural and remote areas, this problem is worse, I would say. So because for like all over the years, I think over the 30 to 50 years, we only had one infectious disease specialist in northern British Columbia. At the moment, I think from this year or last year, there were two. Now there are two doctors. They are actually at the residence period. We got two doctors. So these three doctors are the only infectious diseases specialists at the moment. And we know, like the former doctor I mentioned, the doctor who was treating over the years, soon he's going to take his retirement. So that's why. So I think we have only like limited healthcare professionals to treat these kind of diseases. So these are like these are the limitations we can see in northern British Columbia, and it's actually can exacerbate the problem of HIV and related conditions.
When we talk about HIV in Sri Lanka, in countries like Sri Lanka, because we know that from experience, when we talk about it, people have these ideas of stigma, racism could be related to that as well, and also homophobia. When you say that someone might be infected with HIV, all these words are encapsulated in that term. So people might be reluctant to go there and reach out to the services that are available to get testing done and treatment done. That's the case in Sri Lanka mostly. How is it in Canada? Is the situation the same, or is it progressive, or does it need more attention in that aspect?
Stigma actually can be different in terms of locations. For example, stigma in Vancouver may be much less compared to rural and remote northern British Columbia. For example, like in Prince George, or like beyond rural and remote areas, especially in small communities, because small communities they are not really open-minded, or maybe they do not get enough information or enough education. So that can cause a lot of stigma in small communities. So maybe stigma can be very different depend on the locations. So in terms of HIV, there is so much stigma we can see, and also racism, especially for indigenous. It's not only the indigenous, but also everyone, like especially Black, Indigenous, and people of color, all these communities. We actually recognize them as BIPOC communities, Black, Indigenous, people of color communities, because when they are accessing healthcare, they face a lot of racism because of their skin color, maybe, and because of their race and religion, and also language issues. Sometimes they are not really comfortable to share their concerns with the healthcare providers. That is also has created sometimes of uncomfort and uncomfortability to speak about these issues. So the racism and stigma is so much when it comes to HIV. And also I think in the when it comes to healthcare system, sometimes we can see the mistrust, especially over the years. These indigenous communities and people of color communities have experienced a lot of biases from healthcare providers. So they don't have any trust on healthcare providers, especially on healthcare system. And they all these healthcare providers also have their own prejudices or biases about HIV. Overall, like all healthcare providers are not really educative or informative about HIV, especially like maybe not medical practitioners, but also like related jobs, related employees into healthcare system. They might not really educative or informative about HIV. So they also have their own biases, and they can cause some judgmental behavior towards people who are living with HIV. So that can actually reduce the people who are engaging in healthcare and treatment, and people are not really motivated and encouraged to get the medication. So this stigma and racism is actually a biggest problems we can now see in Canada, specifically when it comes to BIPOC communities. And you also mentioned about homophobia. So homophobian attitudes also really can cause this HIV transmission, and the people are not really choose to get treatment because of homophobia, because we know HIV is very common among LGBTQ communities, specifically transgender and homosexual individuals. So this can actually be a problem, especially lots of healthcare providers do not have this inclusive awareness about equality, equity, inclusiveness, diversity. These concepts are not really familiar with healthcare providers. I'm not saying everyone, but most of them do not aware about these concepts, or they might not have that education. So that can cause homophobic attitudes, and that can actually discouraged people to get treatment. So this overall, I can say like this racism and stigma and also homophobic attitudes are actually discouraging people from getting treatment, because there are some people who are actually, they do not have money to get treatment. So that's why they are not getting treatment. And there are people who are actually choose not to get treatment. So this is two different things. People who cannot take treatments are different from people who choose not to get treatment. So that's why we really need to differentiate these two concepts, and we need to understand there are some people, they want to get treatments, but they choose not to get treatments because of the racism, stigma, and homophobic attitudes.
So you are currently working with Positive Living North regarding these issues. I'm sure that when you're in the field, you see this clearly. So what other strategies have you implemented to address these barriers? And also, what kind of support activities that you have in place with regards to marginalized communities?
Okay, so I will start with the brief introduction of Positive Living North. So we are actually located in 3 locations in northern BC. So Positive Living North is the only Indigenous-led AIDS services organization in northern British Columbia. And we were founded in 1992. So like over 3 decades, we are providing lots of services to people who are affected by and at the risk of HIV, and also people who are living with HIV. So our main location is Prince George, that is trying to cover the northern interior of northern BC, and we have 2 other locations in Prince George and in Smithers and in Fort St. John. So Smithers tries to cover northwest West, and Fort St. John tries to cover Northeast. So these are the 3 locations we work, and we have 3 departments. Especially support services department is directly working with people who are living with HIV. So they have food hub program, because we know, like, if you are taking medications, if you are living with HIV, you need to have good nutritional value. So in order to provide this nutritional value, we are actually having a weekly food hub program for all our members who are living with HIV. And then also we provide hygiene products to them, and we have a positive talk program, because we know this, especially when you are living with HIV and when you are located in rural and remote areas, you are actually feel social isolated. Sometimes you do not get support from your family, and because of that, you face a lot of mental health barriers. So in order to prevent these mental health problems and mental health barriers, we organize a positive talk program every week. That is happening every Wednesday. And then under the department of our harm reduction department, we are having harm reduction outreach. We do daily outreach especially in downtown areas. So we provide clean needles and safe supplies, including condoms, lubricants, etc. And those things are really really important to reduce the transmission among the people who are at risk. So that is harm reduction, and also we provide naloxone training with the harm reduction outreach. And under the education department, that is where I guide my team. So we have educators located in all 3 locations. So we provide education programs to different communities, and we have 3 prioritized populations under our education department. Those are people who use substances, indigenous communities, and frontline service providers. So we identify people who use substances are the group who are really at risk, at higher risk, because they actually sometimes they can reuse their needles, and it can actually HIV can increase transmission. HIV transmission can be increased through injection drug use. So that is why we identify them as one of our priority populations. And then indigenous communities, especially due to the ongoing trauma, colonial effects, as well as the rural and remoteness in northern British Columbia, we identify indigenous communities are also at high risk. And then frontline service providers, especially people who are attached to community and social organizations, and healthcare providers, especially nurses, counselors, social workers, and everyone who are attached to frontline services and healthcare services. We actually provide them educational interventions and trainings, especially on cultural safety and navigating intergenerational trauma. And we do education modules on different topics. So it's mainly on HIV, hepatitis C, cultural safety, navigating intergenerational trauma, harm reduction and naloxone training, gender identities, healthy relationships. So those are really really helpful for our communities to be safe and actually to prevent this disease. And finally, we have a very unique special program called Fire Pit. This Fire Pit is actually a place located in downtown Prince George that is we identify it as a street-level outreach program which provides a culturally safe place for the people who are at risk to access services, different services, such as food, harm reduction supplies, education, and also entertainment. We provide meals every weekday to all our, especially people who are on the street and people who use substances in downtown around Prince George, and also we do like bingos and different kind of entertainment programs like watching movies on HIV or different informal education strategies we use at the fire pit, because these people are really like, they are not really good at formal education strategy. So that's why we actually focus on informal and lifelong educational strategies, especially for this population. So these are some of the strategies actually we use at Positive Living North, and I think we will actually increase and expand our work in the future, because we feel it is really important, especially for Northern British Columbia.
Right. So you were talking about the projects that that are in place right now. So what are some of the upcoming projects that you have that you're planning, or initiatives at Positive Living North that you're particularly excited because that that's going to make an impact on these issues?
Of course, I think I'm really excited about one of our upcoming project that is actually doing workshops for frontline service providers, because we daily observe lots of indigenous communities and other marginalized communities are experiencing racism, and especially systematic racism when they are accessing healthcare. So some of our members actually denying the treatment because of the racism they experience. So I'm really excited about this upcoming project, and in this project we already received funding for this. So we actually trying to do a lot of workshops and discussions with frontline service providers and healthcare providers. And this, our main target audience in this program is future frontline service providers, especially people who are studying in the colleges and the universities, especially international students. So we see this is really important, because we know we have this huge crisis, especially in terms of the lack of healthcare providers in the healthcare system. And we try to actually capacitate and sensitize our upcoming healthcare providers into the system, so we can actually help them to provide very inclusive, sensitive, culturally passionate and culturally sensitive care for marginalized communities and indigenous communities. So I'm pretty excited about this project. And also we are actually trying to expand our services, especially in Fort St. John location, because at the moment we do not have any member, because that Fort St. John area is very conservative, small, rural area in northern BC. So we try to increase testing and prevention options there. We have a good educator based in Fort St. John, so we try to increase our education and especially the capacity of having more testing services for people who are located in northeast area, Fort St. John, Dawson Creek, and those suburb areas. And also I'm pretty excited about we are trying to do like more expansion in fire pit, because fire pit is very interesting and culturally safe space for people who are experiencing homelessness, people who use substances, and people who are at risk of HIV. So we try to do more counseling services, especially with the support of indigenous counselors. So this place can actually help people, especially people who are experiencing trauma among the indigenous community. So we try to expand more services and more education services for the fire pit. And maybe like in the future we try to get more funding, especially to provide storage services for people who are living with HIV, as well as people who are experiencing homelessness, because people who do not have access to stable housing, they should have a place to store their drugs. So that's why we see the need of providing this storage facility. So I think in the future, with the support of our funders, we can actually have something, some place to provide storage facilities for people who use substances, people who experience homelessness, and people who are living with HIV.
So we talked about all these elements that connect to one another: the substance misuse and HIV, homelessness, and stigma, elements like that, treatment, like all these terms, they're interconnected. As somebody who's in the field working with people who are affected by these elements, who are trying to get out of this cycle, as you see it, what is the connection between homelessness and the spread of HIV and uh, your efforts to treat these people with HIV? What's the connection between this homelessness and HIV and your efforts to treat HIV?
Yeah, that's a very good question. I think it's actually, as you mentioned, it's actually a cycle. So, like, we can see intersections of homelessness, substance use, and living with HIV is interrelated, interconnected, and it's a cycle very hard to break because lots of people who are experiencing homelessness and people who use drugs, they are actually they are engaged in high risk behaviors. Sometimes they do not have privacy to practice their sexual behaviors because of lack of housing. So they are living on the street, and they cannot actually sometimes limit their sexual partners. Maybe they are using multiple partners. Maybe they are prone to sexual violence and exploitation. So it's actually can increase the transmission and actually like very risky for our efforts of preventing HIV. And as I mentioned a while ago in my last question, I mentioned that the lots of people who are experiencing homelessness, they have this huge problem of like especially with people who are experiencing homelessness and people who are living with HIV. So they do not have a proper place to store their drugs. So that is a greater problem we also have identified. So this storage issue actually take them away from adhering to consistent treatments. So sometimes even though they know they are living with HIV, since they do not have a proper place to store their drugs, they are not really like encouraged or motivated to have drugs and to have their particular antiretroviral therapies to prevent HIV. And we know in order to suppress your HIV viral load in your body, you have to engage in consistent treatment with antiretroviral therapy. So this, we call it ART, antiretroviral therapy. So people need to engage consistently if you want to have an undetectable viral load in your body. So that is huge challenge these people who are experiencing homelessness and who are living with HIV face, because they do not have in good place to store their drugs. And the next challenge would be, when you are experiencing homelessness, your needs are really different from like, because if you have like basic needs versus your health needs, right? So you are actually struggling to get proper housing, or you don't have proper food, you do not have proper shelter. So those are like really basic needs. So basic needs will be prioritized, but your health needs are not prioritized. So when it comes to that stigma is also that is actually dilemma these people who are living with HIV face, because they have a huge dilemma whether they should prioritize their basic needs or their health needs. So that's why sometimes our efforts can be like not really successful in terms of HIV prevention, because we really need to provide stable housing and nutrition food first in order to prevent HIV with medications and with testing options, because sometimes health is not really prioritized for people who are experiencing homelessness and people who use substances. And the last thing I would say sometimes these people, like people who are experiencing homelessness, they are actually facing a lot of stigma, and they do not want to access treatments. And so also, like people who use substances as the same as people who experience homelessness, they do not want to approach healthcare providers because they face stigma, and because people, like the society, makes assumptions about them. They are really judgmental. Not only the society, but also the healthcare providers themselves can be very judgmental. So they do not want to approach healthcare settings to get treatment or for diagnosis options or for testing options. They don't want to approach healthcare settings. So that is also a huge challenge we face, because it's hard to convince people to come to testing, or maybe to come to different especially for testing options and for the treatment. And finally, I would say these people who experience homelessness can also face transport barriers, and they can actually adhere to medical appointments. Even if they know they are living with HIV, sometimes they do not have stable housing. They might forget their healthcare appointments, they might not want to go, or they don't have a like transport mode to go, so they might not maybe engaged in proper treatment. So those are really challenges we face in terms of health, HIV prevention.
That you mentioned that they might forget treatment, things like that. What came to my mind is that there could be another wheel that we can add to this cycle. That is mental health issues that are connected, homelessness, substance abuse, and HIV, that could actually cause these people to have unstable mental health conditions. So, how do all these aspects connect to each other, as in your experience? Yeah.
Absolutely, because these are like co-current conditions, right? So like substance use actually can increase the mental health issues, and also experiencing homelessness also can cause mental health issues as well as HIV, because these all are like interconnected to each other. So because of they face mental health conditions such as depression, anxiety, PTSD, these can actually make them forgetful about their treatments, and they are not really like prioritize their HIV treatments, because we have some of our members, actually they cannot forget, they're really forgetful, and they cannot actually prioritize, because sometimes they are getting medications for different types of diseases, so they do not remember like which disease, which medications, which disease, so it's too much for them. So that's why they really need some social support from community organizations, or from their own families, or from their own communities. So it's actually helped them to be on the right treatment, and also they can actually increase their self-esteem. And also I can emphasize that these mental health conditions can also occur due to the colonial legacies and residential school system effects, especially indigenous communities experience. So these intergenerational trauma can cause different issues for indigenous communities. It can actually push them to have like more substances, maybe more into substances. It can actually lead to homelessness, and then they can push maybe they can be in high risk because of the homelessness and substance use. So all of these things can actually be really like problematic for HIV prevention. So that's why we really need to prioritize mental health treatment and the importance of mental health in terms of HIV prevention.
Okay, so we talk about this vicious cycle that connects one another. it leads to the dire conditions they're in, and the dire conditions that has been there for years, decades in Canada. Is there light at the end of the tunnel? Like, if somebody needs to, I'm pretty sure everybody, most of them need to get out of this cycle and to see the light. So what support systems are available in British Columbia for people who are dealing with not both, but all these issues like homelessness and substance misuse, HIV and mental health issues? How can where can they reach out to get out of this cycle they're in?
Okay, so there are so many programs, support services, and strategies that are available in British Columbia for people who are living with HIV, as well as people who experience these intersections like substance use and homelessness. So the first organization I would emphasize first is the Ribbon community. They are actually previously known as AIDS Vancouver. They are one of the first HIV community-based non-profit organization in Canada, as well as I think in whole Northern America. Like, they are one of the first. And they are founded in 1983, as far as I can remember. So they are still doing their HIV prevention, treatment and support programs. They are very popular among people who are living with Metro Vancouver, and also Positive Living North. Especially, we are actually working in Northern British Columbia. And also, I know there is another, there are a few organizations that are based in Vancouver. Especially, they are directly working with people who are living with HIV. They are not only prioritizing Indigenous communities, but also like different marginalized communities. Especially, there are some organizations available for Afro-Caribbean communities in Metro Vancouver area. So those are really good support services for people living with HIV. And we have a very successful program called Insight. This is the first legal drugs consumption site in whole Northern America that is actually located in downtown Vancouver. So they are really they are actually very popular in whole Northern America, and they were like really internationally recognized because they are providing a safe space for people who use substances, and they are monitoring medically. They can actually get a lot of medical supplies, not only for substance use, but also to prevent HIV. So they provide clean supplies, condoms, lubricants, as well as clean needles. So they are one of the biggest and one of the prominent consumption sites in whole Northern America. And we have different research centers as well, especially those attached to provincial government, BC provincial government, especially Provincial Health Services Authority, BC Center for Excellence in HIV/AIDS, BC Center for Disease Control. Those are really good centers. People can actually have their, like, get more information, education, and people can see up-to-date information on research and innovative strategies for HIV. So these are really successful strategies to prevent HIV in BC, and actually they have made a very substantial progress towards HIV, reduction of HIV transmission.
So as people who live in British Columbia, we encounter these people on a daily basis on our commute. Maybe when we go to community centers, we come across these people every day. And what can we do? What is the responsibility of the community? in supporting unhoused people and people who have substance use disorders?
That's a really good question, because community can actually be a very good strength for people who are experiencing homelessness and people who use substances. So the first thing would be they can actually help to reduce stigma and discrimination. Because we know, like, when you see people who are experiencing homelessness and people who use substances, usually some people make assumptions and they make judgments about this community. So we really need to educate ourselves and others, maybe our friends, family, our communities. Through education and through increasing awareness, we can actually help to reduce discrimination. So I feel community has the biggest responsibility to reduce stigma and discrimination, especially to be non-judgmental and to be very cooperative, to be supportive towards this community, because there are so many misconceptions. Some people think because these people who experience homelessness, they face these conditions because of their immoral behavior, or people who use drugs, maybe they are actually involved in criminal behaviors. So those are the really like misconceptions or judgments or assumptions towards this community. So with like increasing awareness and providing education and especially sharing information, right information, we can actually help to reduce stigma and discrimination. And the next thing, there are so many community initiatives, community organizations, which are really helpful for these communities. So our community members can actually donate food items, or like even their time, even their maybe through money. They can actually donate or volunteer to these different community initiatives, which are really helpful for these communities, so that we can actually be a very supportive community for those who are experiencing these struggles. And also there are lots of community initiatives sponsored by government, and there are so many local government programs, local government initiatives. So communities can actually be supportive. Maybe they can participate in different programs which are organized by local governments. So through this active participating, through sharing right information about local government initiatives, community members can be supportive, those who are struggling with substance use and homelessness. And the other thing, there are so many research initiatives as well. Nowadays, we can see there are so many community-based research options. So maybe community members can participate in those research, and they also can give suggestions, because we really value community input, community suggestions, so which can really like helpful for these communities, and they also can be part of these community initiatives. So I think these are the good ways of supporting one another. Especially like encouraging open dialogue and reducing these judgments about these different types of behaviors of the community. They can actually be helpful and supportive for those who are struggling in our communities.
When identifying these people and connecting with them and finding responses, finding answers for their issues, you might, as somebody who is in the field, you might come across some issues with the policies that are in place that hinder these the development of your work. So what are the required policy changes, as you think, that should be implemented to support these vulnerable people?
First of all, I think the stable housing program. I think we really need to increase more investments, more funds in stable housing programs, because it is a huge problem in British Columbia and in some of the other parts of Canada as well. So I think we really need to focus more on increased investments in stable housing, because through stable housing we can actually expedite our process of preventing HIV, because that is really support to people living with HIV, especially to store their drugs, to have a proper place, through having a proper place, actually giving them hope to adhering to their treatment. And then they will not be in very risky behaviors, or like they are not will be prone to violence and exploitation if they have proper housing. So increased funds for housing is one of the prominent policies we need to focus on. And the second thing, I think, integrated care model. We really need to focus on integrated care model, because we know, as we discussed a while ago, we know this cycle.
Can I interfere you there? Can you explain what that is for somebody who's not familiar with it?
Yes.
The integrated care model.
Integrated care model means we know, like, this is a cycle, right? This homelessness, substance use, HIV, mental health. This is actually a cycle hard to break. So lots of people who have these intersections need one place to have their supplies or to have proper treatment. So this place called integrated care model actually can help with all these issues, especially this integrated care model clinics actually can help people who use substances. They can actually provide medication for substance use disorder. They can actually provide counseling. Then also they can function as a harm reduction site, because then they are providing legal consumption site, and also they provide clean needles, safe supplies, condoms, lubricants, which are really helpful to prevent HIV. So this is the integrated care model I actually want to emphasize, because it is really important, because all these people can use one place as their major site for treatment and prevention. So they would not go to different places for different issues. So I think this integrated care model would be really supportive and helpful for their future prevention and treatment strategies and treatment options. And the next policy strategy, I would say, we need more funds to harm reduction strategy, because that is really important, especially for rural and remote areas. There is a lack of harm reduction sites. Harm reduction supplies can really cause lots of issues. It's not just for HIV prevention, but also we can actually stop and limit overdoses that we are experiencing in BC and overall Canada. So increased funding for harm reduction and having more harm reduction supplies available, especially to rural and remote areas, would be really important. And the next would be maybe especially, like, we know we have this problem like lack of healthcare providers. So we really need more healthcare providers. We really need more social workers, counselors, nurses, medical practitioners. Those are really important positions which can help people who are living with HIV and people who are experiencing these homelessness and substance use. So we really need healthcare practitioners and substance and frontline service providers in rural and remote areas. So I think all these like policies actually can help the people who are experiencing these different intersections. And the one last thing, I think government should initiate a process or policy to capacitate healthcare providers on cultural sensitivity. We actually identified this need already. That's why we are trying to providing more education for our healthcare providers on cultural sensitivity. So in this way, we can actually reduce racism, stigma, and homophobia, and ensure the trust of healthcare system in with the for the people who are struggling with these issues. So this increasing awareness and having ensure this cultural sensitivity awareness among healthcare providers is really crucial and significant in terms of future policies that government needs to think of.
Right. So let's talk about you and AIDS 95, 95, 95. So what is this? And let's first talk about what that is, and then let's talk about Canada's progress in this one.
So UNAIDS 95, 95, 95 is actually worldwide initiative, and because UNAIDS is the international organ of advocating for the rights of people who are living with HIV. So it means 95% of people should be diagnosed, and 95% of these for those who are diagnosed should be on the treatment, and 95% of people who are on the treatment should have undetectable viral load. So that is what we actually mean as 95, 95, 95. And we should be proud to say Canada overall has achieved this, and also overall BC has made a substantial progress to achieve this 95, 95, 95. So as a province, we have exceeded these targets, but still, like in northern British Columbia, I would say, we are not really like more quicker and more faster and more successful in terms of HIV testing. So without testing, we cannot identify who are living with HIV. So we are still experiencing some gaps due to lack of testing in northern British Columbia. So even though we are exceeding the targets in overall BC, I think we can experience some gaps in terms of rural and remote parts of BC due to the lack of testing and due to the lack of healthcare providers. So I think we should emphasize having more testing opportunities. At least maybe it will be more harder to have in-person testing, or maybe in-person clinics. At least we can use some of the technologies, right? Maybe we can do like mobile health clinics, or maybe telemedicine we can use. I know some of the areas, some of the parts in rural BC are using these telemedicine and mobile units, but it is not happening the entire northern BC. So if we can actually have more telemedicine options and more mobile health units as a policy, or maybe as a healthcare strategy, I think we can actually achieve 100% in the coming years, but we should really focus on rural and remote parts of BC.
So as we discussed, this is a vicious cycle. Once you get into it, it's really difficult to get out of it, because usually one thing leads to the other, and it's really difficult to get out of it, and you get stuck in this cycle. So for those who use drugs, recreational drugs, what advice do you have to give them in order to not to abuse them and ultimately be a part of this cycle? What do you have to tell them?
I think, first of all, this harm reduction education is really important. So through this education, people would know what are the uppers and what are the downers. So what are the uppers means what drugs can give you more energy if you want energy to your body. And what are the downers means what are the drugs which can help you to relax and to calm your body. So first you need to understand what your body needs and what your requirement is, and then you can use these recreational drugs. It's okay because as a part of as part of the government policy of decriminalization of using drugs, you can use drugs, but it should be with much aware and much education, because through this, and the responsibility, of course, because through this harm reduction education, you can actually reduce harm can caused by drugs. And also in some places like Vancouver, as I mentioned earlier, there are some medically monitored legal consumption sites like Insight, which is located downtown Vancouver. So you can go to these places. So you will be monitored by medical supervisors, medical practitioners, and it is a legal consumption site. So you won't be penalized or you won't be charged for anything. And you will be 24/7 monitored. So that will help you to reduce the harm caused by drugs. So, and I don't think we have these kind of sites around BC. So maybe there are few available, and there are some needle exchange programs. Even in northern BC, you can come to, like, especially for needle exchange programs operated by healthcare providers, especially Northern Health, Interior Health, Vancouver Coast Health. They have needle exchange programs. So you can go to these places and maybe you can have some guidelines or have some guidance when it comes to substance use. So then you won't be in a problem or you won't be getting into this cycle.
Right. So we had an extremely fruitful and a resourceful discussion with Vibusha today, and we are really thankful that you joined us in this podcast today among your very busy schedule. And do you have anything to add to this conversation that we had to conclude?
I would emphasize, as we discussed earlier, like it is very important to support our people who are living with HIV and people who are unhoused and also people who use substances. As a community, we have a responsibility to support them, especially in a friendly manner. So I would be suggesting for our communities to support our efforts as community-based organizations. We are having an upcoming program. It's our annual awareness event called AIDS Walk. This is happening in this year. This is happening on September 20th, Friday, in downtown Prince George. So we are planning to increase awareness around HIV/AIDS, and also you have a possibility to support us in our efforts to eradicate HIV from our communities. So we are you can actually support us through volunteering, and you can donate your time, money, and anything you would be willing to donate, maybe some dry rations or hygiene products, clothes, food, or anything, or any monetary donations also acceptable. So you can actually join us if you are interested in joining with us to support our communities. And also, you can actually go into our social media platforms and website. So we are readily available. If you are living with HIV, if you know your health status, please join us. Especially if you are located in Northern BC. Even if you are not located in Northern BC or any other part of BC, still we can help, and we can actually connect you with some other organizations who can help you in other parts of BC, because we have a really good network with the organizations which are working with people who are living with HIV. So we can connect you, we can provide referrals, we can actually support you to increase your awareness and to support you not just physically, mentally, and also spiritually. So those are the things I would like to mention in the conclusion of my interview. And also, I really want to be grateful for the community I'm working with. Because of them only, I'm highlighted to provide this interview. That's why you are interviewing me. So I'm really grateful for the community I'm working with. Even though I'm not a person who is living with HIV, I'm a HIV negative person, but still I have this experience from the people who are living with HIV. So I'm really grateful for them to share, because on sharing the experiences, because without them, I don't think I'm also can be in this position to provide this interview. So I really want to thank all of our members, patrons, and all the communities I work with. So I really want to mention my gratefulness to them. Thank you.
So thank you so much, Vibusha, for joining us today. And with that, we conclude today's episode of North Pacific Podcast. We have a lineup of podcast episodes that are really useful, that discuss timely matters. So be sure to join our platforms and stay tuned. Thank you. Bye-bye.